Can you imagine like the influencers like back then, what they'd be like? Hey girlies, get ready with me.
I got myself a lovely tapeworm.
Yeah.
I'm going to drop
I'm just going to put my lead paint on and then I'm going to go and flirt with the plague doctor.
It's a dead center.
So today we're talking about cosmetic surgery and death.
Okay.
And we're facing a population of people who love little tweaks, don't we? We all love a little tweak.
Have you ever had a little tweak?
I've never had a tweak.
Ah.
I'm just naturally gorgeous.
I saw that. Yeah.
So I think it's a topic close to our hearts. We are a generation of people, we seem to be, who are either Botoxing or breast surgery, tummy tucks, turkey teeth. We've all heard of turkey teeth.
Yeah.
Mommy makeovers and BBLs.
What's a BBL?
Brazilian bum lift.
What? I didn't even know that was a thing. Really?
You've never heard of a BBL?
I get out of bed and do squats in the morning, sweetheart. No one told me this is possible.
A BBL is like the in thing to have. Like it's where like it snatches in your waist and you get a big bum, yeah.
Yeah, okay.
But yeah, so today we're talking cosmetic procedures and how they affect us.
Dying to look good.
Absolutely. I know you've had a bit of Botox, you've told me that before. What was your motivator?
Age.
Wrinkles.
Well, interestingly, when I first went for Botox, the lady, I didn't know her, and she said to me, "What do you do as a job?" So, and I was like, "Why?" And she's like, "You've got a really expressive face." And I was like, "Is she just being diplomatic for saying I'm a wrinkly old bag?"
You look like a Shar-Pei.
Wow, your face is gross. No, and I was like, "Yeah, I mean, I'm quite an expressive person." I said, "I'm a singer." She said, "All right." And then proceeded to tell me all about the lines around my mouth. But so I had these lines here. I don't know what they're called. And because we're not on camera today, the lines that,
Like the Homer Simpson.
Yeah. My daughter last night, she said to me, "Have you got those from smiling, Mom?" And I was like, "Yeah."
No, they're from being miserable.
Yeah, no, the ones. So I had those done ages ago with filler. Filler lasts longer than Botox.
Okay.
And I
didn't even know there was a difference.
Didn't you?
No.
Yeah, I mean, the Botox was used originally, wasn't it, for like sweating and stuff like that.
It can be,
all sorts of things, like medical things. And then they realised,
hold on a minute,
we can make a load of money out of this. Yeah, I had that, and I had Botox. And Botox just doesn't last very long, but it's amazing when you have it done.
Really?
Yeah. I mean, I'm not...
Is it addictive?
Yeah, but obviously I was poorly 2 years ago, so I couldn't have anything like that done. So I haven't had anything for 2 years. So that's, what you see is what you get.
And it looks great to me. I don't think you actually need any Botox.
Or I could iron my forehead.
Honestly, I don't think you...
Yeah, well, I'll find you a picture of when I had it done and you'll be like, "Oh, see, right."
Yeah. Book that in, sweetheart.
Yeah, there's a little slight arch in the eyebrows and all this crow's feet here.
So does it just make you look younger?
Yeah,
it's feel younger.
It smooths your skin out. But when you have Botox, it isn't immediate. It takes about 10 days to take full effect. And so you just keep looking in the mirror and you're like, "Oh, wow, I am literally going
aging
down in numbers."
Yeah, it's like death becomes us. Take the potion.
Yeah. But where do you draw the line? That's a really, really good topical question.
How much would we risk to look good?
Yeah, would I fly to Turkey to have things done? I don't know. Would you?
I don't know if I would. I mean, to be honest, the relative numbers from deaths from plastic surgery is quite low when I was researching
It's just the stories are horrifying.
Yes. I mean, I sent you some stories, didn't I, about people who've been and had surgery, and the pain they're in and what they come back like seems horrendous compared to what it would be like if you had it done in the UK, but it's also a fraction of the price. So you can see the motivator for people.
Yeah.
So most people who have plastic surgery and die from it, they don't die from the surgery, they die from complications afterwards.
Yeah.
So things like blood clots or fat embolisms. And so any sort of risk like that, any surgery, you get those risks. Yeah. But those complications are like fat embolisms are quite
Is that like
regular.
A lump of fat in your body just floating about?
Because it can block your lung or something like that, and part of your lung, and obviously can be fatal if not treated properly.
Wow.
So, I mean, do you want to hear the death by surgery rates? So
I do, yeah,
so
definitely.
1 in 5,000 people.
Is this UK or is this worldwide?
This is UK.
Okay.
The mortality rates for liposuction are 1 in 5,000.
Okay, so 1 in every 5,000 people in the UK.
Could die will die, has died from liposuction.
Wow.
BBL is 1 in 3,000 or 1 in 2,000, depending on what you read.
Okay.
So BBLs have the highest risk of complications
Do we know
due
why?
to fat embolisms, because they're moving fat and stuff
fattier
around.
area, yeah.
Infection, bleeding, scarring, and blood clots. There's a higher risk of dying from having a BBL than there is from skydiving.
Wow. That really gives you some perspective, doesn't it? So interestingly, my mom had breast reduction.
Okay.
She had it granted for health purposes because we're all little. We're little frames and we've all got pendulous big boobies, myself included. And so she got it granted because she started to have a curvature at the top of the spine.
Yeah.
And she had the leading surgeon in the country at the time do it through a private hospital, but through the NHS.
Yeah.
And well, I'm going back some time now. It wouldn't happen now. And when I went in to see her before surgery, it looked like they'd drawn a map on her. They took 1.5 pounds of weight off each breast and moved the entire areola up by 6.5 inches.
Whoa.
And took her down something like four sizes. And she wanted to go smaller, but there's a limit to what they'll do. However, even with all of that in a private hospital, leading surgery, she's still got an infection. Had to have a tap, is it called
Drain.
a tap? Yeah, drain.
A drain, yeah.
On the side. And it was an incredibly long process for healing. Incredibly long. And compared to having a boob implant, I don't know the statistics, but I know that the actual operation to have implants is very short. It's literally 2 cuts and pop them in. But the operation to have them reduced is much more complicated.
Yeah.
Much longer.
Suppose you have to reattach things and...
Well, people
Yeah.
can lose sensation and...
Yeah.
Well, that can happen with any surgery, I suppose, can't it?
Yeah.
But
But
I remember
rather-
her saying afterwards, people saying to her, have you lost weight? Because they didn't know she was like really top heavy and she just sort of...
I think
had
that was quite regular. You know,
Yeah.
that was a big thing on the NHS, wasn't it, back in the day?
Well, yeah, you have those indents in your shoulders from your bra shoulders. I've got
Yeah.
them. Really uncomfortable.
Yeah.
But yeah, I don't know how much of that would be granted now.
Yeah, I don't think a lot of it would be.
No.
And surgery here is extortionate. It's so expensive, like cosmetic surgery.
Yeah.
But if you go to Turkey, you might get the... instead of the Kim K, you might get the RIP. She might die from it. But have you heard, like, so filler, you were saying to me, is different to Botox.
Yeah, it's a different substance.
Have you heard of filler migration?
When it moves?
Yeah.
I have. And also when I had these lines done, I got lumps, little tiny lumps, and they tell you to massage them. So you have to put your hands inside your mouth and massage them out.
Oh my God. So
For the
whether
first couple of days, yeah.
so that they don't move anywhere else, or so that it
so
just
they stays
smooths
in
it
that
out?
area and it smooths it
Okay.
out. But when they did it, she was like, because obviously it's pliable, she did it and really worked it in.
Okay.
Because these lines here, because I've sung my whole life, were quite marked. But I had this done years ago and it lasted. So filler lasts a lot longer than Botox.
And it stays in your body forever.
Yeah. And the thing with your lips, I learnt this. So obviously we live in a time now, don't we, about where this look that we would have once called a trout pout or duck face is now really fashionable for both men and women. But the skin here on your lips is membrane, isn't it? It's not the same as the skin everywhere else on your body. And therefore, it isn't designed to hold the weight of filler. So when people have, do they do it in milligrams, something like that? You know, and it goes in via
mils,
injection.
yeah.
When people start to have a lot of it, it sags, basically. And so they have to keep having it to make it keep looking full. But it sags because the skin isn't designed to hold that kind of weight.
Oh, I just don't. I don't personally. I don't get it. I don't get the
I
look.
had some in my mouth, but I had it done around the line at the top.
Yeah.
And again, because I'd been singing my whole life, it was just more sort of stretched, I suppose.
Yeah.
But I've only ever had it done once. I don't know if I'd
Do it again.
I got a fairly big gob as it is.
I was going to say it couldn't get much bigger.
Shut up.
But yeah, so Turkey is well known for cosmetic surgery. You hear a lot of people go into Turkey.
Yeah, yeah.
And it's called cosmetic tourism. So they go like on
it's got a
holiday.
phrase.
Yeah. So they go on holiday and then they end up, or they go to there.
And they end up dead.
No. But they go there like a tourist, but they actually go for surgery. They go for, there's lots of men go for teeth and for hair implants.
I've seen it with my own eyes.
Yeah.
I've been on Bumble. I've seen
Have
what
you?
that looks like. Fucking hell.
You need to show me the pictures.
I'm going to show you the pictures. There's a lot of.
It's,
I mean, some of the teeth. I always think of the episode of Friends with Ross.
Yeah.
When they glow. I mean, there are some people that that's a look they're almost choosing.
Some people like that, don't they?
Yeah.
So it's cheaper in Turkey. There are less barriers for surgery, so you haven't got to be. I don't think they do health checks. Like you haven't got to be healthy a certain way. They're just happy to operate on anybody, and it's quicker. But the result is that many surgeries are having to be redone in the UK from botched surgery procedures or from infections and things.
And then I suppose they are going in as, if they're infections or whatever, they could be going into the health service here in the UK as an emergency.
Yes,
and they're having to sort that out.
Absolutely, and a lot of them are having to have multiple surgeries when they come back to the UK.
Yeah.
And I'm not trying to put anybody off because what you want to do is up to you.
Yeah.
Do you know what I mean?
This is the point of the episode, though, is to highlight what.
Yeah, just say that there are risks, but there are risks with everything.
Yeah.
What's life without a bit of risk? Swear that. If you want it, it's risky.
Having
Do
a
it.
drink. And most
Absolutely.
people do that every day. So.
Absolutely. It's risky crossing the road
is around
sometimes,
here.
especially around your house. Yeah.
It's that hole in the road.
So the British Association of Aesthetic Plastic Surgeons, or the BAAPS, as they like to be known.
The BAAPS?
Yeah.
The BAPS.
The BAPS.
So funny. Somebody somewhere went, yeah, we can get away with that.
Yeah. They've noted an increase in complications from procedures from overseas. They say that they pay less, so there's poor quality, and the surgical standards are lower than what they are in the UK. It's important to know that not all procedures overseas go badly, because some go really well, don't they?
Well, in a majority sense, the majority go well.
Yeah. But it's like you said in the UK, your mum had private surgery,
Yep.
and she's still got an infection. So it is, it's one of those things, isn't it?
Oh, yeah.
Research a surgeon.
Yeah, well, yeah.
Try your best to do that.
Yeah.
I've had a few deaths from people who've been away for surgery
Have you?
and come back to the UK and died.
you?
Yeah. And it's normally because of complications like blood clots and things like that. That's
really?
what's killed them.
And are they young people then? Presumably fairly
Some,
young.
yeah, middle-aged. Like mid-range. I say middle-aged because that's my bracket.
Yeah.
I say our bracket.
Yeah.
Not necessarily younger people, but some like in the middle.
Yeah.
People who normally had their kids, I think, and then
Okay. Going for a little makeover.
yeah, mummy makeover or whatnot.
So you've had a few then come through your doors?
Yeah, and it's always interesting when you see a corpse with plastic tits
Because they stand upright.
because everybody else is just sat
their
naturally,
armpits.
and they're just prominent. So
Wow.
even as a corpse, your boobs look great.
And I'd imagine if you've had a lot of work on your face, obviously when you're dead, there's no, like, your muscle tone changes, doesn't it? And it's sort of, because you're on your back.
Yeah.
Your sort of face falls backwards a bit, doesn't it?
Well, I
So
suppose
if you've got loads of work done on your face, it's going to still be very pert looking, isn't it?
yeah. Well, filler stays with you. Botox
No, it's
disappears.
Botox got like shelf life for 4 to 6 months.
disappears, dissipates into the body. But when you're dead, so you're relaxed. So
Yeah.
no one's wrinkles look bad.
Oh no!
Do you know what I mean?
Yeah,
So
yeah.
really, it's wasted on the dead. But have you heard? There's a famous case going on at the moment, and I can't say too much about it because there's still an inquest
Okay.
in process about the. Have you heard of the Patterson case?
No.
So Ian Patterson was a disgraced plastic surgeon,
Right.
and he allegedly carried out unnecessary operations on women
Oh.
for breast surgery.
Okay.
He was jailed in
I
2017
have heard this story before.
for
yes.
performing botched surgery, and there's around 65 cases that are still
okay.
ongoing, and his actions led to delays in cancer treatment in some patients, allegedly,
Okay.
and which resulted in death.
Okay.
So that is obviously still ongoing, but just goes to show you that sort of there are people.
But his actual surgeries didn't result in death; they were just all unnecessary.
Unnecessary, maybe not required. Imagine having, allegedly having your boobs lopped off and you didn't have cancer.
Oh wow! Wow, that's what was
So
happening.
unnecessary surgery.
Not
I
a
don't
boob
know
man
the
then.
full. Not a. Very much was a boob man, I think.
Keep them in little pots.
But the less said about that, the better. But yeah, so that, I mean, there are cases where
I'm interested.
surgery's
in
gone
I want to
terribly
go
wrong.
back to the mortuary where you are. I want to know. I know you have to be guarded, but your job when they come in is to determine their, or help determine their cause of death. And so when you've had people come in that have had obvious surgeries, cosmetic surgeries, sorry,
Yeah.
is it your first thinking? You're like, see what's gone on elsewhere with that?
Yeah, because you get the history.
Do you?
So, yeah, you get the history. You get to, you'd see, obviously, if someone's had surgery. Actually, any surgery.
Yeah. Okay.
So anything they've had done, not just cosmetic procedures. A lot of the time, cosmetic procedures will go to when we identify somebody.
Yeah.
As part of our, you'd maybe look and go, oh, yes, it might be an identifier for
I
them.
wonder if it'd be the case ever where they've had so much work.
That they're unrecognisable.
Unrecognisable, yeah.
You need a DNA test.
You need some dental records to
Yeah.
sort them out, yeah.
Oh, not where I've worked, but yeah. Yeah, so I suppose a corpse with breast implants, they're just slightly more perky than...
Oh, I mean, I have just got the most graphic image in my head now, and I'm just going to go for it. So, body's decomposing, and they've got boob implants, and let's just say they're just decomposing, and all the flesh is rotting away, and things are happening.
Just see the little pouches.
Just little pouches of silicone there and on top of the ribs, and they just stay there.
Yeah, basically. Sometimes when you open them, and if they're very slim or they've not got much fat, you can sometimes see the pocket where the implant's gone in.
Really? Yeah. Mind you can actually
I've
see
cut
that
through
on
one
living
before,
people.
and it's proper gloopy
Ooh,
glue.
really?
Yeah, it's really unpleasant.
Really?
So you can imagine.
So they don't stay as sacks.
No, they do. But if I've cut through, if I've had to open or cut through, if I've cut through the body and it's sometimes it might catch them or whatever, or it has done in the past.
Yeah.
Sometimes they burst.
Yeah.
You get people where they burst and it sort of migrates around the body.
And that kills them.
silicone, it just can't be healthy, can it?
No.
But it's literally pasty type,
Wow.
sort of clear, but
Like glue,
gluey,
yeah.
very sticky, not pleasant. Post-mortem Botox for the dead. Have you heard of that?
No.
So I think it's not actual real Botox. It's what they use for restoration techniques in funeral homes.
Okay.
Now, we wouldn't use anything like that. I don't know much about it, but it's like a tissue builder.
So if somebody's
It's
been in
injected
an
into the
accident
skin.
or something,
No, I mean,
okay.
potentially.
Or to make them look as they did. I know that you've
maybe a
talked
bit more
about-
makeup. That might be. If we're reconstructing in our mortuary, we don't use makeup. We would just use sewing and whatnot.
Yeah.
But maybe at a funeral home, they might use a tissue builder, which adds plumpness to the skin.
Okay.
It's a bit in the UK, I think we just use embalming fluid, and that sort of adds that life,
And because it's coloured,
lifelike
isn't it?
look, and sort of fills up all the bits that maybe just a bit sagging, around the eyes and whatever, plumpens the skin. Plumpened, is that a word?
I don't know, but it should be.
So yeah, there's no wrinkles on a corpse.
So when you say post-mortem Botox, it's not Botox. It's things that are used to give the presentation of.
Yeah, I don't think it is Botox. I think it is now in the UK. It might be in America. I think in the UK it is embalming fluid.
Yeah.
That's what they
I
use.
suppose it's not really new, is it? That's been around a very long time.
Yeah.
Trying to make
Botox
people
wouldn't. I don't think Botox would work on the dead, would it? Because doesn't it work on the muscles?
Yeah.
And the muscles are relaxed. So
Yeah. Well, like you say, once they're dead, they look more peaceful and their eyebrows aren't quite as high up.
yeah. So yeah, I don't think it would work on the dead. There has been some legal cases about Botox. I know you can get anything on the internet these days. We were talking about weight loss injections earlier, weren't we? You can get them dodgy versions
Yeah, probably.
on the internet that are not regulated, but because the price of them are so expensive, people will buy the cheap ones and they don't know what's in them,
Well, yeah.
but they're happy to inject them.
But I think that is the same of all pharmaceuticals. If
Absolutely.
you can't get it on prescription, or it's hard for you to do so, or it's a drug that you really want, people will find a way of getting it.
And that's the same as Botox because
Well, Botox now, you used to be able to go to anyone who'd qualified in doing Botox, but it has to be prescribed by a doctor now. So
okay.
it's shut a lot of people,
so
their
you have to,
businesses down.
do you have to be a registered nurse?
So there's lots of prescribing nurses that are now doing Botox because they make more money. How sad is that? They
Yeah.
make more money doing that than they do
Saving
their
lives.
jobs. Yeah,
It's terrible.
But and if it's just a regular nurse who hasn't got that qualification to prescribe drugs, they now can't do the Botox. So even if they've had training, they can't do it in the UK anymore.
Okay.
Has to be somebody to prescribe it first.
Wow.
So it's. I know a couple of people who do it as their business, and it's put them out of business, basically, out of that part of the business.
I wonder if that's because of legal cases.
Yeah, it will be. Yeah, 100%. I mean, we can be sort of down on the UK, can't we? But actually, it's usually fairly on top of things like that. If there's been enough cases of it going wrong, they try and moderate it in some way, don't they?
Yeah, I mean, there was a couple of deaths suspected to be caused by botulism poisoning, which is a rare but life-threatening condition caused by botulinum toxins, which is the stuff that's in Botox.
Yeah.
And like I said, it's linked to unlicensed products and things like that.
Wow.
And is it safe? Is Botox safe? What do you think?
I mean, I would imagine, like anything else, you're interfering with the natural progression of things, and you're injecting anything into your body. It probably comes with a load of risks.
Yeah.
But I think if we have to look at things relatively, so if you are going to go along that method of thinking or that train of thought, we've also got to look at what we ingest. What are we eating? We can't sit on the side of one thing and say, I know, I'm really anti-filler, cosmetic surgery, Botox, or anti all of those things, and then, go away and eat a McDonald's. You've got, for me, I think you've got to have a broad and open mind about all of these things, because whatever you put into your body, whether it's injected or ingested, has consequences.
Absolutely. I think, if it's used correctly, then absolutely it's safe. And it's got loads of medical uses, like you were saying earlier.
Yeah.
So
They use it in people's jaw a lot, don't they?
yeah, you can have it for, there's like a condition with the...
They use it for migraine.
Yeah.
Use it. I used to work with a lady who had it for migraine, and as a result had an amazing forehead.
Oh, really?
Yeah, it was. It literally,
and never a headache
It worked
inside.
like that, but it really did help her migraines.
Yeah, I know someone who had torticollis, which is like a twisted neck,
Right,
like a
okay.
stiff neck, and they injected
And it helped.
Botox, and I think it helped marginally. I don't know if it ever cured it.
I mean,
but-
I suppose the argument is like, cancer care treatment, like chemotherapy. We know it's both good and bad.
yeah,
But
it
it's
kills
got-
everything.
Yeah, but it's
Even
gotta
the
be-
cancer.
It's the same as
Yeah.
so many things, isn't it? You've got to, do your research, and I suppose if you're going to do it, go to a practitioner that's recommended or that you've done your research on.
Yeah. I remember that saying, beauty is pain. Pain is beauty. You've got to go through these
Well,
things.
even as basic as looking after yourself and getting yourself in
Waxing.
the gym. Waxing. For God's
That is
sake.
painful.
It's like self-hate.
But the ancient origins of beauty and beauty like care from the Egyptians, where they used arsenic for glowing skin.
Yeah. Was it the Tudors that had lead paint as well on their face? Have you got that on your notes?
Yeah.
I remember I worked for a historian. We toured around. and
Victorians, were they?
No, these were Tudors. Actually.
Tudors.
But yeah, so it was Queen Elizabeth. wasn't it?
Elizabethans,
So
yeah.
she had, her skin was just pockmarked. She had alopecia. So
Yeah.
she had no hair at all on her whole body.
What a beauty.
Yeah, and I'm sure there was something about having wooden teeth, because most of them had no teeth by the
Yeah.
time they went into adult. Yeah, so yeah, I have heard some of the horrors through history.
Yeah, apparently that it would like make their skin fall off.
Yeah, I imagine it would if you put
Yeah.
lead on it.
Gross.
Don't use makeup with lead in it.
The old Victorians were fond of a tapeworm to lose weight.
Oh my God.
Nothing quite like a parasite to help you get the pounds off after
is
Christmas.
is it any worse than using the injections that are really popular now?
Well, it's natural, I suppose, isn't it?
I mean, how do you get that out?
I don't know. Death.
Coax it out,
Post-mortem.
coax it out of the bum somehow.
Yeah. Come on, little worm. Disgusting. Can you imagine like the influencers like back then, what they would be like? Hey girlies, get ready with me.
I got myself a lovely tapeworm.
Yeah.
Gonna drop.
I'm just going to put my lead paint on and then I'm going to go and flirt with the plague doctor. Absolutely
Need to
vile.
drop a few pounds before I go out this weekend. Got a nice tapeworm. Wow.
Oh God, people are actually dying for the perfect selfie. That's the sad thing, isn't
Yeah.
it? So I think you've just got to remember that you can be buried with your fillers, but you can't take your filters with you.
What an interesting is that? Does that conclude
That concludes
our
my
episode?
for today.
Wow, yeah. Wow.
But yeah, I think you should do what you want.
Would you
Everything's
do
the
it,
right
though?
moderation. I don't think I would.
You don't think?
No, I think,
Not when you're as naturally beautiful as you are.
wow. I think I would be too frightened to get it done. Anything, I'm like a bit of a wimp. I get my nails done.
I don't think that's the same.
No, but I think I would be too frightened to have anything injected in case I really liked it and then it was a slippery slope for me.
Yeah.
I would, however...
That's what she said about heroin.
Yeah. I would, however, be open to like meeting that woman from Death Becomes Her and her giving me a potion.
Okay.
And
a
making
potion,
me
yes,
beautiful.
But an injection, no.
Well, yeah. No, I wouldn't do anything like that. I don't think. Personally, I don't think. I'd never say never. You never know. In 5 years, you might be like, excuse me.
Yeah.
Why are you looking so surprised and shocked?
Well, I've got my boobs tied around my neck. Thank you, dear listeners, for tuning in to It's a Death Sentence. Please keep listening to our weekly episodes.
And if you like our show, please like, share and subscribe.
We are dying to talk to you.